Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Now, some of you future radiologists out there already can tell that we're looking at a kidney in this image. And actually, a few of you know that you're looking at glomerulonephritis because you see increased echogenicity and reduced cortical thickness without reading the description. You make me so proud. We're going to be discussing this and much more on this presentation of chronic renal failure pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to the updated material. Now, chronic renal failure. What is that? Well, simply put, chronic renal failure is end-stage kidney failure, right? We don't want our patients to get to this stage, right? Chronic renal failure is caused by vascular insults, inflammatory issues, tubular insults, glomerular insults, and even other inflammatory insults, right? Could be autoimmune or just from your immune system responding to some sort of pathogen. So we're going to discuss all of this. The most common causes of chronic renal failure include hypertension, diabetes mellitus, and glomerular disease. Clinical features that often show up on clinical vignettes for chronic renal failure include uremia, hypertension, hyperkalemia, anemia, hypocalcemia, and even renal osteodystrophy, right? Don't forget about that one. Uremia, in particular, is the result of increased levels of nitrogenous waste products in the blood, hence azotemia. Uremia symptoms include nausea, anorexia, pericarditis, platelet dysfunction, encephalopathy with asterixis, right? You remember that physical exam finding with the flappy hands, right? Asterixis. Urea crystal deposition in the skin. There's a derm finding. As well as salt and water retention with resultant hypertension. Complications of chronic renal failure include hyperkalemia due to the renal disease affecting potassium homeostasis with metabolic acidosis, insufficient renal bicarb production and decreased bicarb reabsorption, anemia due to reduced or absent erythropoietin synthesis, hypocalcemia due to the decrease in 1-alpha hydroxylation, right? You remember that happens in the kidneys. The vitamin D metabolism, right? Renal osteodystrophy caused by secondary hyperparathyroidism, osteomalacia, and osteoporosis can occur. And cysts often develop within shrunken end-stage kidneys during dialysis, increasing the risk for renal cell carcinoma. If severe enough, the chronic renal failure is treated by medications like ACE inhibitors, angiotensin converting enzyme inhibitors, that is, dialysis, and even kidney transplant. And with that, you should have an understanding of potential clinical vignettes or questions regarding chronic renal failure, right? Pretty straightforward, right? No fluff. Happy studying, keep up the good work, and I'll see you later.